that burning, urgent feeling, the constant need to run to the bathroom. If you have had a urinary tract infection, you know it, and you probably know that antibiotics usually clear it up fast. But here's something more people need to understand. Sometimes the antibiotic does not work, and the reason why affects all of us. It is called antibiotic resistance. The CDC considers it one of the most serious public health threats we face today. Here's what that means in plain terms. Antibiotics kill bacteria, but bacteria are living things, and they adapt. When bacteria are exposed to antibiotics over and over, some of them figure out how to survive. Those survivors reproduce. Over time, the antibiotic that once worked stops working, not because the medicine changed, but because the bacteria did. UTIs are right at the center of this problem. They are almost always caused by a bacteria called E. coli, which normally lives in the gut but causes trouble when it reaches the urinary tract. Because UTIs are so common, especially in women, antibiotics for them are prescribed millions of times a year. That much use gives bacteria millions of chances to adapt. According to research published in Nature Reviews Microbiology, resistance to some commonly used UTI antibiotics has been climbing in communities across the country. Some UTI-causing bacteria are now resistant to multiple antibiotics at once. So what drives this? A few things. Taking antibiotics when you do not actually need them, like for a cold or flu, which are caused by viruses, not bacteria. Stopping a prescription early because you feel better. Using someone else's antibiotics. Every one of these habits gives bacteria a chance to adapt without fully being defeated. When a licensed provider evaluates you for a UTI, they may send a urine sample to a lab, a test called a urine culture. That culture identifies exactly which bacteria is causing your infection and which antibiotics can kill it. Sometimes a provider starts treatment right away based on common patterns, then adjusts if the culture results show resistance. That careful process matters. It is why seeing a licensed provider is so important rather than guessing on your own. The good news is that you have real power here. Only take antibiotics when a provider says you need them. Always finish the full course, even when you feel better. Never share prescriptions or use leftovers from a previous infection. Simple prevention also helps. Drink plenty of water, urinate after sex, and wipe front to back. Fewer infections mean fewer antibiotics needed overall. If you think you have a UTI, do not wait it out. Untreated UTIs can spread to the kidneys, which is a much bigger problem. Telehealth services like SendClinic let you connect with a licensed provider from home. They can evaluate your symptoms, order a urine culture if needed, and guide you toward the right treatment. Here's your takeaway. Finish every prescribed course of antibiotics completely, and never pressure a provider for antibiotics when they say you do not need them. That one habit protects both you and everyone around you.